Okay, the first question is, what type of exercise programs do you recommend for your patients? And what I recommend is a exercise program that has 4 parts. One of the components of an exercise program is really aerobic fitness. So this is bicycling, rowing, doing things like this. The second one is strengthening, and a lot of this is either weight machines or small weights. The third is stretching, and yoga can be really good for this. And the fourth part, and I think this is really important, is really agility. Looking for things that will help you with your balance and help prevent falls. So I think this agility is very important. Things that help with agility, some things are like learning how to tango dance is one thing that's popular now. Other things are people try boxing with a punching bag where they're shifting their feet and swinging their trunk. And there are a variety of other activities such as that are good for maintaining or helping you maintain your balance and preventing falls. How much should you exercise? Well, the recommendations are that you exercise for 30 minutes a day, at least 5 days a week. And more is better, but that should really be a minimum. And you don't have to try to have all 4 components that I've just talked about in each day. And so 1 or 2 days could be cardiovascular fitness, other days could be strengthening, and other days could work on balance and stretching. Now, one of the questions is, does exercise actually slow the progression of the disease? Well, this is not known for certain. There are some studies in animals that suggest that exercise may actually either help repair the dopamine system that's damaged in Parkinson's disease or prevent further damage. But that's, again, not certain. But what is known is that exercise changes what happens in your brain, and it actually has a lot of beneficial effects on the basic chemistry in the brain. And this is sometimes referred to as neuroplasticity. So even though it may not directly combat Parkinson's disease, it helps the brain compensate. And there's no doubt that people do better with the disease if they are exercising. And it does prevent the consequences of Parkinson's disease from being as severe as they might be without exercise. So another thing that can be very helpful to people in trying to either prevent falls or if they're beginning to try to either reduce the number of falls or prevent any further falls are exercise programs such as Tai Chi or Pilates. And in many parts of the country now, there are classes that are specifically for people with Parkinson's disease that use one of these 2 forms of exercise, or as has been mentioned elsewhere, dance is another way of doing this. So I think I can't emphasize enough that we think it's very important for people to keep moving and moving in a way that helps improve their balance and their agility. So simply walking in a straight line or getting out and walking around the block is not going to challenge the balance system as much as trying to dance, doing Pilates, doing Tai Chi. So I always urge my patients to incorporate some of these other exercise programs into their exercise regimen. And the other benefit is if they're done in a group, there's great social interaction and it's really fun. So people really enjoy that as well.